How many retirees do you think get hit with a penalty that never, ever goes away? Not as many as you'd think simply forget. Actually, more than you'd think miss it without ever realizing they missed anything at all. And once you see the number, it will all make sense why so many people are quietly overpaying for Medicare every single month for the rest of their lives. So let's talk about Medicare enrollment, because most people treat it like a formality instead of what it actually is: a strict, unforgiving system with permanent financial consequences. Most people assume Medicare just kicks in at 65, the same way it seems to for everyone else's parents or grandparents. And in one narrow sense, that's true. But the parts that actually require you to take action are the parts that quietly cost people the most money, and almost nobody explains that distinction clearly before it matters. Here's the basic structure. Medicare has 4 parts. Part A covers hospital stays, and for most people it's free and automatic once you've paid into Social Security for enough years. Part B covers outpatient care and doctor visits, and this one is not automatic. Part C is Medicare Advantage, a private insurance alternative to original Medicare that bundles hospital, outpatient, and often drug coverage into one plan. Part D covers prescription drugs, and it's sold through private insurers approved by Medicare. For most retirees, the 2 parts that actually require action are Part B and Part D, and that's exactly where the trouble starts. Here's the number that stops people cold. According to the Centers for Medicare and Medicaid Services, if you delay enrolling in Part B past your initial enrollment period without qualifying employer coverage, your premium goes up 10% for every 12-month period you waited. Permanently. Not for a year. Not until you catch up. Forever, for as long as you have Medicare. Miss 2 years, and you're paying 20% more every month for the rest of your life. Miss 4 years, and it's 40%. On top of whatever your premium already is. Most people hear that and assume it must be a rare edge case. It isn't. It's baked directly into the structure of the program, applied automatically and without exception once the window closes. The Initial Enrollment Period, or IEP, is a 7-month window built around your 65th birthday. 3 months before your birthday month itself, and 3 months after. That's it. That's the whole window. And a lot of people don't even realize the clock is running because nobody sends a giant flashing warning. You just get a birthday, and somewhere in the fine print, a deadline. And here's what makes it worse. This isn't a window that pauses if you're busy or confused or dealing with a health scare or simply didn't get around to reading the letter. It moves forward regardless of what's happening in your life that year. A lot of people assume there's some kind of grace period built in, some cushion for real-life circumstances. There isn't. The 7 months are the 7 months. And this is where things get interesting, because the story isn't really about people being careless. It's about a system that assumes everyone already understands the rules, when most people simply don't. There is one major exception, and it's the rule most people get wrong. If you're still working at 65 and have creditable employer coverage, meaning insurance that meets Medicare's minimum standard, you can delay enrollment without penalty. That part a lot of people do know. What they don't know is that the moment that employer coverage ends, whether from retirement or a layoff, you have exactly 8 months to enroll in Medicare. Miss that special enrollment period, and the penalty applies anyway, as if you'd never had a valid excuse at all. Part D works on a similar logic, but the penalty math is different. According to CMS, the Part D late enrollment penalty is 1% of the national base beneficiary premium for every month you went without creditable drug coverage. 1 month doesn't sound like much, but stack up 2 or 3 years of gaps, and that penalty compounds into a real, permanent monthly cost added to your premium for as long as you're enrolled. And because that base premium can change from year to year, the dollar value of the penalty isn't even fixed. It's recalculated annually, which means the cost of that original mistake can quietly grow over time, long after most people have forgotten they ever missed a deadline in the first place. Once you understand that, the anxiety a lot of retirees feel around Medicare starts to make a lot more sense. Research from the Kaiser Family Foundation has found that a significant share of new Medicare enrollees report confusion about enrollment timing and the penalties attached to missing it. This isn't a small, uninformed minority. It's a widespread pattern across income levels, across education levels, across people who did everything else right in planning their retirement. Think about that for a moment. These aren't people who ignored their finances. Many of them tracked their 401k balances carefully, paid off their mortgages early, and did every other part of retirement planning by the book. Medicare timing was simply the one piece nobody handed them a clear roadmap for. But here's the thing. The enrollment penalty isn't even the trap that catches the most people off guard. There's a second one, and it hits people who did everything right. It's called IRMAA, the Income-Related Monthly Adjustment Amount, and it means higher earners pay more for Medicare Part B and Part D. According to CMS's 2026 figures, single filers earning over $106,000 and married couples earning over $212,000 face these surcharges, and they scale upward from there. Here's the part almost nobody sees coming. IRMAA isn't based on your current income. It's based on your income from 2 years earlier. So a Roth conversion, a home sale, or a large required minimum distribution in 2024 can quietly raise your Medicare premium in 2026, long after that income event is over and done with. Think about how strange that is for a second. You could retire, lower your income dramatically, and still get hit with a surcharge 2 years later because of a decision you made while you were still working. And the surcharges aren't small, symbolic amounts either. Depending on the income bracket, IRMAA can add hundreds of dollars a month to your Part B and Part D premiums combined for an entire year, based on a single snapshot of income from a year you may barely remember by the time the bill arrives. So, what do you actually do with all of this? If your income temporarily spiked, but has since dropped due to retirement, divorce, or the death of a spouse, the Social Security Administration allows you to appeal your IRMAA determination using Form SSA-44. Most people never file it, simply because they don't know it exists. There's also a quieter trap sitting inside the Part C versus original Medicare decision. Many people enroll in Medicare Advantage at 65 because it looks cheaper up front, and later decide they want to switch to original Medicare with a Medigap supplemental policy. But Medigap insurers can use health underwriting outside your initial window, which means a new diagnosis can lock you out of coverage you once could have gotten guaranteed. Original Medicare paired with Medigap tends to cost more up front, but it offers flexibility that a lot of people don't value until they're the ones being denied. This is the choice most people don't fully understand until years later, when their health has changed and their options have quietly narrowed without anyone telling them directly. By the time it becomes obvious, the guaranteed issue window that would have protected them is already long closed. None of this is designed to scare you. It's designed to show you where the tripwires actually sit, so you can step around them instead of finding them the hard way. So here's what actually matters going forward. Mark your 65th birthday window on a real calendar, not a mental note, because that 7-month period is the whole game. If you're still working, confirm in writing whether your employer coverage counts as creditable, and set a reminder for the 8-month special enrollment period the moment that job or coverage ends. Use Medicare.gov's Plan Finder tool to actually compare Part D and Advantage options instead of guessing. And if you know a big income event like a Roth conversion or a home sale is coming, build in a 2-year look-back reminder, because that number will follow you into your Medicare premium, whether you remember it or not. Organizations like AARP publish detailed guidance on exactly these decisions, and it's worth spending an hour with that material before your window opens, not after. A lot of people feel behind when they hear all this, like they should have known these rules years ago. You shouldn't feel that way. Most people are never taught this. The system rewards people who happen to stumble onto the right forum post or the right conversation at the right time, and punishes everyone else with permanent penalties that quietly compound for decades. But once you know where the deadlines are, and once you know the forms exist, you're no longer guessing. So here's the real question. Do you actually know what day your 7-month window opens? And if not, what's stopping you from finding out today?